This segment sponsored by Femme Medical Spa. Welcome back to Women's Health Wednesday with Dr. Ashley Scott from Femme Medical Spa. Hello, doctor.
Hello.
Welcome back.
Thank you so much.
Yes, okay, so on these Wednesdays, we're going to highlight things that women are going through, things that are not being talked about but need to.
Yes.
And you have such experience and through your profession and so much knowledge, I can't wait to hit on these topics.
Okay, me too. I'm ready for whenever you got questions.
Okay, good. Okay, so today let's hit on fibroids.
Okay.
I think that's a major thing. It's something that impacts women at a higher rate than people realize. And it's not until you start talking to your girlfriends or just sharing symptoms with your doctor that you realize it. So what are fibroids?
So fibroids are benign masses that can grow in the uterine cavity or in the uterine musculature. So it is normal tissue that just kind of grows out of control. It has a lot more blood vessels feeding to it, and so that can lead to abnormal symptoms like heavy bleeding, pelvic pain, urinary incontinence, all kinds of things.
Yeah, and it really does impact women and they don't know that it's that.
Yes.
So what is that about? Is it that screening just isn't in place for it and you have to just have these major symptoms before you start talking to your doctor?
Well, I think it's important for women to understand what the symptoms are, because what I notice in my patients is that, you know, they normalize things like, oh, I've always had bleeding this heavy. So they don't even recognize that that is a symptom that is not normal. So I think the first part of it is educating on what is a normal menstrual cycle and what is not. And then from there, you know, women can understand, you know, what level of concern that they should have. But one of the things that we can do to screen for it is when you come in for your annual exam, even if you're not there to get a pap smear, we still want to do a pelvic exam. And what that allows me to do is just to feel the anatomy and test for that mobility and the size of the uterus. And if it's enlarged, then that helps me to identify that, okay, maybe there's fibroids here and maybe we should do some imaging to just confirm that diagnosis.
Yeah, and that mass can range, right?
Yes.
To like a little bitty size of a what?
Tiny little
like
pebbles.
A blueberry pebble.
Or
okay.
even smaller than that to, you know, masses that are the size of a baby's head even.
Really?
I would say probably my largest fibroid was one that extended all the way up to the diaphragm. And so it was a very big surgery, and that was one that we wanted to do, you know, with other surgical professionals as well because of all the increased risk that there were for that patient.
Yeah, and I think learning when people think about fibroids, it's a scary thing because what we kind of know educationally is just the fact that it can cause infertility. It can cause, you know, long-term issues. You're like, oh my God, do you have to get a hysterectomy? You know, do you have to have your vagina completely removed? Like, those are worries. And so if someone has fibroids, that's not the end of the world, right?
No. So, you know, this is why I think it's important for us as providers to stay updated on all of the new technology and medications that are coming out, because the treatment options are varied, you know, and I am usually discussing with the patient, what are your goals? Because I never want to overtreat or undertreat. I always want to make certain that we're keeping the patient centered. And so, you know, if this is someone who maybe has some challenges with, I can't get off of work, you know, to be at home for a long recovery, then, you know, we want to talk about medical options. So there's hormonal medicines and non-hormonal medicines. So truly there is something for everyone.
Right. And it's not severe. All cases aren't severe.
No.
You can live with fibroids, right?
Yes, and a lot of women don't even know that they have fibroids. So they can go their entire lives and have these masses that exist in their uterine cavity, but they are asymptomatic, so there is no reason to do the workup. And it's something that we can even find just incidentally if we're trying to, you know, find or work up another issue that they have. But, you know, typically, if patients are symptomatic, they're usually complaining of heavy, prolonged menstrual bleeding. So that is usually the menstrual pattern that we see with fibroids. There are other ways that people can have abnormal bleeding, like bleeding in between periods, but I usually am not thinking of fibroids when I think of bleeding of that nature.
So that's the main symptom. What about pain? Is it called cause pelvic pain.
Yes, and so the pain a lot of times is dependent on the location and the size of the fibroid. So obviously larger fibroids can compress against other organs and that can increase your discomfort. Also fibroids that are lower in the pelvis, that can be a lot more uncomfortable because it can feel like a constant pressure symptom.
Right.
So when I am doing imaging, it's important for me not just to know that there are fibroids there, I want to know exactly where in the uterus are they, because that is what is helping to drive my counseling and drive what management that we're going to do.
Yeah, okay. So there's a lot of options, and non-invasive options, all the way to surgery. So that should give people just like a peace of mind knowing that if you have fibroids, it's not, it's manageable, or there's a medical procedure that can help.
Right.
Yeah.
And, you know, some of the procedures, you can go home the same day and there's very minimal pain. There might be 2 small incisions in your belly and that's it. That procedure is one that I happen to love. It's called a SESA. And so we're using heat to destroy the fibroid. So fibroids are usually very firm masses, and so with the heat, by destroying that tissue, we can soften it, we disrupt the blood supply, so that can halt the growth, and then over time, that fibroid shrinks. And so the beauty of that is, let's say this is a single mom who needs to manage her symptoms, but also, you know, she has kids to take care of.
Yeah.
Well, if she can have a surgery like that, she is back to her normal routine within a few days or up to a week.
Oh, wow.
So not only have we fixed the issue for her, you know, she didn't have to take off time from work to have it done.
I love that. Oh, so much hope.
Yes.
So much hope. Okay, we can talk forever about fibroids.
Yes.
This is something that we have to revisit and dig in deeper. So thank you so much for your knowledge and information today.
Absolutely.
And if you would like more information about Femme Medical and Spa, we'll have their website listed below, and I'll see you after the break. This segment sponsored by Femme Medical and Spa.